Okay.
So, good afternoon, everyone, and thank you for joining our new XpanDH webinar. This webinar, we will talk about the unlocking the benefits, the real-world application for the European electronic healthcare record exchange format. So our discussion will be targeted around the European electronic exchange format and how this can be adopted. And we have a good group of speakers I will present you shortly. Before starting, just let me introduce a little bit some housekeeping rules so that we can organize this webinar in a good way. So first of all, in order to support the discussion afterwards, just unmute yourself when you want to speak or ask the question. So don't have your microphone on all the time. Also, there is a Q&A box, so please try to put your questions there as the presentations are ongoing, so that we can all address all of them at the end of this webinar, so that all questions are answered by our experts that will present. If you want to address the question to a specific person, so please direct your question to one of the presenters. Also, I would like to note that this webinar will be recorded. So next slide. So I'm Alexander Berler. I work as a Director of Consulting Service at Gnomon Informatics, and I will be your moderator here today. Here is our agenda. So initially, we will have 3 short presentations for our 3 distinguished speakers. So Esther Peelen, Kathy Apostolidis, and Michael Strabin. Then we'll make a discussion with our 3 speakers, and at the end, we will have hopefully vibrant discussion with all of you, trying to respond to your questions and provide as many answers as possible. So let's start. Next slide. So just 1 minute, a few things about our project, XpanDH. So XpanDH stands for Expanding Digital Health Through a Pan-European Electronic Exchange Format based ecosystem. So it's a 2 years coordination and support action financed by the Horizon Europe Framework Program. We have 26 digital health partners from various domains, very well formed consortium. And our overall aim is to prepare, support, and empower individuals and organizations to be ready to adopt the European Electronic Healthcare Record Exchange format via an established network of networks and a vibrant ecosystem. So we are trying to bring all the important people around this topic in the same room and try to provide solutions on that this exchange format can be adopted in parallel of the upcoming electronic health data space, the European health data space regulation. Next slide. With this, I would like to give the floor to our first speaker, Esther. She is a senior international advisor at Nictiz, Competence Center for Digital Transformation Management in Healthcare in the Netherlands. So, Esther, please give us our view about the exchange format. And thank you very much.
Thank you very much for the introduction, Alexander, and good afternoon, everybody. Yeah, my name is Esther Peelen. I work at Nictiz, and just to introduce very shortly Nictiz, what we do is we contribute to the national vision and strategy for healthcare information management in the Netherlands, and also to the architecture that supports the system. We provide advice and share knowledge with the relevant stakeholders within the healthcare sector. And lastly, we also develop and maintain standards to support the healthcare processes in the Netherlands. Our motto is to have better healthcare through better information. And here it says Europe, but as a national competence center, we focus on the Dutch situation. But of course, it's my task and of the team, of the international team and other colleagues, also to look at the connection with what's happening in Europe and to make sure that the healthcare information can be received in the Netherlands and also vice versa. Next slide, please. Yeah, with this journey, I would say, I would like to share with you what we currently are working on in the Netherlands to get this connection with Europe. So last year in February, we can say that we are that we have a national contact point for e-health in the Netherlands. And for example, here you see a Portuguese family who leaves Portugal to go on a city trip to Amsterdam. But unfortunately, the father gets involved in an accident and needs care in a Dutch hospital. So the healthcare provider is contacting the national contact point in Portugal and requests the patient summary, the European patient summary of the father. Via the national contact point of e-health in Portugal, the patient summary is sent to the Dutch physician, and she can check based on this the healthcare status of the father, so that the physician, the Dutch physician, can deliver the best possible care to the father, and in the end, the father or the whole family goes back home to Portugal. So this is the journey that we are capable of doing in real life, receiving European patient summaries from 3 countries currently, from Czech Republic, Portugal, as I said, and Luxembourg. And the next program is already set up to also send the European patient summaries from Dutch citizens whenever they are in other European member states when they need healthcare. Next slide, please. Yeah. Currently, we are in a really exciting period, I would say, in our country, because the Ministry of Health team, together with a lot of stakeholders, especially from the healthcare provider side, have been working really hard to set up a regulation or legislation, which is called WEGIS, on digital information exchange in healthcare. like I think in many other countries, digitalization of healthcare information is a bit lagging behind and is felt as a really problem by the citizens as well as the healthcare professionals. And to drive this information exchange, that's the goal of this legislation. And it has passed chamber last year in September, and recently in April also in Parliament. And this Saturday it will come into force. So a lot of efforts are being done by many stakeholders at the moment to really make it happen. The Vegas envisions a step-based approach for implementation, and it will start this year and lasts until about 2028. With this step-based approach, it envisions to exchange patient summary data as first, to have a generic set of data for specialist care, compliant to national standards that we agreed on in the Netherlands. So we agreed on the processes and also on the information that needs to be exchanged. The same for nursing discharge reports, medical imaging, medication, which covers a lot of processes, I would say. So from prescription and dispensation, also realizing a medication overview, so that really the citizen and the healthcare professional know what medicines are being used by this particular person. It includes also lab results for medication process and adverse event monitoring. So it's really a broad process, and we are in the middle of implementing this at the moment. And recently also emergency care process was added to these domains that have priority. The last point covers certification of EHR systems. So we want to make sure that we prevent vendor lock-in, and also to achieve real interoperability. So the information must be exchangeable between various systems. And for this, we have a certification process in place to make sure that we can actually test that the information is really going from one system and can be processed by the other, the receiving system. Next slide, please. So with this said, which is an effort that takes already a lot of our resources and work from many stakeholders at the moment, there's always the European Health Data Space proposal. And of course, we have to look into that. We cannot close our eyes for that. So to find out where we are from in the Netherlands, so we would like to have the position from the Dutch situation upon the European situation. We are performing fit gap analysis. And as you can see, a number of processes or domains, as you would like to call them, are similar. And so we are comparing upon the interoperability model. So on various levels, where are the gaps and where are the similarities? So we have a good understanding of where especially the gaps are and how we can best address those gaps and see if they are risks or if there may be nothing to worry about. But in case we see risks, that we can really see how we can anticipate to overcome the gaps. So this is a continuous process because also the standards are still in development at both sides. So at the Dutch side, standards are being developed, and of course standards are never completely stable. They get updates all the time. But also if you look at the European guidelines, for instance, we have now 2 new ones coming up for hospital discharge reports and one for medical imaging reports. So we have to do our checks again, like what are the gaps and the similarities. Next slide, please. That was my last, yeah. So this is helps us preparing for the future and the connection with the European Healthcare Information Exchange. Thank you.
So thank you very much, Esther, for providing us this initial, let's say, analysis and point of view from a competence center, how these issues are adopted from a European member state. Now I would like to give the floor now to Kathy Apostolidis. She's the past president, chair scientific committee at the European Cancer Patient Coalition. And now I think it's important to see a little bit the view of the citizens and the patients, let's say. So we are all citizens and we are all potentially also patients. So I think that within this approach of designing new services that will reuse the exchange format, the European exchange format, I think it's important from now on directly to start by taking care and using the voice of the patients as well. So Kathy, please, the floor is yours. Thank you very much.
Thank you, Alexander. Good afternoon to all. As Alexander said, I am the past president and chair scientific committee of the European Cancer Patient Coalition and a long breast cancer survivor. And I have to mention that since early, I have been interested in what the digital health could do for cancer patients. So my participation in the project is more than meaningful for me. We are going to talk about what is the European Electronic Health Record Exchange format, because it is something, let's say, difficult to understand for the average patient. We are going to see what are the 4 pillars that cover patient needs, 3 broad categories of apps facing needs of patients, particularly cancer patients, and the key benefits that the European Electronic Health Record Exchange format offers for patients, and any other advantages. So could you please change the slide? Okay, so what is the European Electronic Health Record Exchange format? This is the official let's say, term of what is it, and what we have to keep in mind, it is that the European Electronic Health Record Exchange format is a set of principles and of specifications and process that allow data to travel from one country to another, but also from one hospital to another and within regions. This is particularly important for cancer patients because our disease takes very long to get addressed and cured, something like a minimum of 2 to 3 years, and often much longer. Therefore, it is very important for us to have access to our patient records, because usually before digital health, we were and still are going in some countries to our medical appointments with a heavy bag of MRIs, CT scans, other records, lab tests, etc. So this is history now. with digital health and the electronic health record, which is already established in some countries, but not in all EU member states, and definitely not in my country, Greece. Next slide, please. So what are the needs of cancer patients, particularly from European electronic health record exchange format? What do we need? Here I have mentioned 4 such needs. They are much more, and here I have to mention that I have participated in a European Commission expert group a few years ago, where we have designed the criteria which shall govern mobile applications. But as these mobile applications for health were not all meant for medical purposes, the criteria were not so strict, but nevertheless, among those criteria were these 4. And for cancer patients, interoperability and privacy are the key too. Why interoperability? Because we often have to move from the hospital where we are initially diagnosed and treated to an expert cancer center. And then we need to have all our tests, data and information moved from the initial hospital where we were diagnosed and treated to the new one. And equally, privacy of our data is very, very important for cancer patients. Cancer patients are willing to share their data and their biosamples for cancer research and for getting the care they need, but they demand that their data are treated with respect and privacy. Therefore, these 2 are most important for cancer patients. And also self-management. What does this mean? This means our ability to go into our electronic health record and check what has been noted since our last visit, make sure that all the information is correctly mentioned, that data makes sense, and if something sounds not correct, that we have the possibility to make a note in the electronic health record so that our physician notes it when he opens it again. And collaboration. Collaboration is a great, great word. And it is the word that has also reigned in our annual Congress that was held this last weekend in Brussels, last Friday and Saturday. Collaboration was the word of the day. Why? Because in cancer, we need the collaboration of many specialties, of many medical and other specialties, technical specialties, IT specialties, human sciences specialties. So collaboration is very important for us among doctors and patients. So which are the apps, the applications which are important for cancer patients? Those are that ask for individual patient data, the applications that provide a more personalized user experience, the potential to input to an HR system, as I said before, and the ones that enable better collaboration of patient and clinician in given medical conditions. And here I would like to refer to the eSmart project that has finished in 2019, that was a digital mobile application that cancer patients could use when receiving chemotherapy, and was enabling them to refer their symptoms to the research center, and if something went really bad, they could be called in to their hospital and get treated. This gives extra confidence, not only to the patient that during chemotherapy, his symptoms and his care is taken care of, but also to the physician to know that his patients are being taken care by the research nurse who knows everything that is going on in a given number of patients. Next slide. So what are the key benefits of the European electronic health record exchange format for patients? These are many, and I would like to mention that it provides an accurate, up-to-date, and complete information on patients at the point of care. It enhances privacy and security of patient data. This is a very delicate issue here because we all know that the patient data have been retrieved from countries which had a very strict systems like the USA. So this is a very important point, privacy and security of patient data, and I know it has also been much discussed within the European Health Data Space, the joint action on European Health Data Space that has finished soon. They enable safer and more reliable prescribing. They offer quick access to patient records for more coordinated and efficient care. They improve patient and provider interaction and communication, and as well as healthcare convenience. It is also very important to mention that the European electronic health record exchange format enables to promote legible, complete documentation and accurate streamlining, coding, and billing within healthcare systems. Finally, it securely shares electronic information with patients and other clinicians, and it helps provider more effectively diagnose patients, reduce medical errors, and provide safer care. Thank you.
So thank you very much, Kathy. I think the message is very clear and very important. We need to focus on at least the first thing that I note here, and we will discuss it later, is that we need to find a way to explain the exchange format in simple words for the patient so that they ask for it somehow. Mm-hmm. And now I will pass the floor to Michael Strabin. So he's a senior advisor for digital health at Digital Europe, who is the voice of digitally transforming industries. So I guess, Michael, you will explain a little bit how from the implementers part, so the people that can implement solutions. So the other side of the coin, let's say, how we can do and what we should do so that we can have an applicable electronic exchange format very soon. So Michael, the floor is yours.
Thank you, Alexander, already for the introduction. Digital Europe, yeah, we're a trade association based in Brussels, indeed the voice of digitally transforming industries. Let's go right into the next slide, please. So I wanted to start first maybe with and thank you so much to the to Esther and to Kathy for setting this up, and I think this is going to be an interesting discussion, I hope. The industry view on interoperability is relatively benign. We really welcome, we really think that digital health needs more and better interoperability. Interoperability can lift all boats, so to speak, if we can enable the digital transformation of healthcare. Interoperability, a functioning ecosystem, really opens up opportunity and services for new players. All of us can think of how interoperability has enabled mobile telecommunications, banking, other digital industries. Digital health is, healthcare is ripe for the digital transformation. The reality, of course, is that there's been inconsistent adoption or demand for interoperable products. I mean, we have in Europe a divided competencies in healthcare, and we can probably talk about how a European legislation can filter down in a world where, of course, national and regional actors are responsible for healthcare and for the delivery of healthcare and implementing these digital health solutions. Also, of course, we have competing priorities. Health is different than other industries. We prize in healthcare, first of all, patient safety and efficacy. These are the must-haves for products and services. Only then do we consider things like connectivity and interoperability. And we, of course, also work in an industry that is under tight regulatory constraints. But the industry wants to contribute to an interoperable ecosystem, provided that we have standards and common specifications that are open, so they can't be proprietary. They need to be international. European is also fine and good, but our industry very often works in international contexts, and we would like to sell products and services not just in Europe but internationally. And finally, of course, these specifications, these standards need to be developed with industry. Next slide, please. Let's unpack a little bit what we mean when we talk about industry. I mean, we have different players with vastly different perspectives, requirements, and business models. We have, of course, makers of IT and cloud systems. Among them, makers of EHR systems. I think they are probably the first clients, of course, of the EHR exchange format. But we also have makers of connected medical devices and diagnostic devices, the medtech industries. We have makers of large devices like imaging machines in hospitals, but also small devices, wearables, sensors that are patient-facing, that are worn by patients, operated by patients, including smartwatches that have CE marks. We of course also have makers of software and apps, including those that are CE marked, but also well-being apps that are not regulated under the medical device or in IVD regulation. So we have a vastly different, vastly diverse landscape of industry players here, including big players, legacy players, and also startups and SMEs, innovators, and people who work in their garages on new products and services. Industry delivers what market demands, and the market has sent mixed signals. I mean, I talked already about the competing priorities, patient safety, efficacy, and accuracy. Interoperability, of course, is further down the list. And so therefore, makers of digital health products and services need, first of all, incentives. I mean, we need from the demand side, clear demand for interoperable products and services. We also need common, robust, and stable common specifications. I mean, we and the EHR exchange format, as detailed and defined in the EHDS regulation, already has a nice list of these common specifications, including data formats, technical specs, standards and profiles for the exchange of electronic health data. And then, of course, we also need testing mechanisms and conformity assessments. Esther, I note with great interest that you, of course, also have those types of features built into the WEGIS legislation. Next slide. And my final slide. The role of the EHR exchange format, and let's step back for the moment and acknowledge we probably need a better term for this. This has been a term that is, I think, in need of disruption as well. We need to find a better term that rolls easier off the tongue. So far, industry has looked at the EHR exchange format with what I could call benign indifference. I mean, we've seen EHR specifications, EHR exchange format specifications advanced in projects like eHealth and now XpanDH. But these projects have not yet translated into actual use or demand. So far, My Health at EU has so far barely managed to establish 11 links between member states to member states. I note, of course, what's happened in the Netherlands, that there is an effort now to match, to translate the EHR exchange format into national legislation. We need more of that. And I think we've seen also already in XpanDH, countries like Greece, Hungary, Portugal, Slovakia, and others look at these developments. However, the major players look at bigger national markets. So for example, German makers look primarily to Berlin, and we haven't seen EHR exchange format make a splash there. So far, the EHR exchange format is not quite yet there, and it has not yet filtered down to national specifications or procurements, where then industry looks up. And I know that I need to come to an end. What we now need, I think, to drive forward, to advance the electronic health record exchange format adoption, is collaboration. The EHRs legislation contains what I would call new levers of interoperability, because they require, they empower the European Commission together with member states to develop specifications via delegated acts. EHR vendors will be required to comply with the EHR exchange format by 2027-28, and I saw in the Netherlands you're already looking at EHR certification. That's a great sign, but that's only for the Netherlands, and we need to make sure, we need to avoid an EHR exchange format for the Netherlands and one for Germany and one for yet the other countries. We need to move towards a harmonized way to certify these. Well-being apps, medical devices may then filter down. I think we will see a filtering down of a trickling down of these interoperability specifications. So there is a powerful signal from the Commission, from the European level. It now needs to travel down to the national level. So we need now collaboration with industry involvement and of course patience. But let's move forward. And I think the European Commission and member states together have given us a powerful goal to move forward to. Thank you. And with that, I'd like to hand over back to you.
Thank you very much, Michael. I think we got the impression of how we see this from the market side, so from the industry, and we need to think how what we should do so that it's more attractive also to the market side. Okay. So, and I saw that you mentioned the term rebrand. I think the rebranding of the term of the exchange format is a good point that potentially could be also a point and a topic of discussion within XpanDH. We have invented quite a lot of new terms, so I think this is probably a good task that we can achieve so that it's more attractive to all the members of the ecosystem. So that point is taken, at least from my side. Now, I think we can move to the next topic and the, let's say, discussion. So, in parallel of this, let's say, short discussion that we'll have with the three speakers, try to analyze a bit more in details what they have presented to us. Please use the Q&A button to give your thoughts and your questions so that we can also take them into account and try to respond to as many as possible of those. So I will try to make some initial, let's say, questions to the three experts and speakers. So firstly, I would like to ask Esther. Esther, you are from a National eHealth Competence Center, probably one of the most advanced one. You have also a good support of legislation. So, but how do you see where should a competence center should put the effort so that we can increase the adoption of the electronic exchange format? So in other words, how can we reduce and control the challenges that you face in your daily work to increase the adoption of the exchange format?
Yes, thank you for this question, Alexander. And indeed, the suggestion for a rebrand could be a good one, but I think we also need to describe and make clear what exactly we mean with the exchange format. What does it entail? Because it's a broad concept and it's not completely clear to everyone, I think. The first step, in my view, would be to create awareness. Just share knowledge on the exchange format. Tell people that it's out there, and stress the benefits it can bring that Kathy already nicely shared with us. So to open up the eyes of the stakeholders in your countries, because yeah, in my experience, people are very much focused on what's going on in their country or even in their own region or maybe institutes or organization. But it's good to create awareness and to let people see that there is a healthcare world around your own country, and that you can actually use this when you try to connect with the European or even international information flows, to put it very broadly. We are so used as customers to travel and have all data of our bank details, of our, I don't know, food that we buy. We are very much used to that it's there everywhere. It's just available. And it's a big, the opposite in healthcare. And if you think your health is your biggest asset, in fact, then it's kind of strange that it's not the case. So, yeah, to broaden the perspective and explain how the European exchange format can facilitate this, I think is a good first step. And it's, of course, simpler said than done, because there's a lot of effort needed to make it really a reality. But it all starts with, I think, the awareness and think, more in a broader way than just your own country. And I can only embrace what, as well as Kathy and Michael stressed very well, is collaboration. So try to find your peers, exchange experience, look for good examples where it works, and learn from that and take it from there.
Okay, so I guess that the message from what you say, Esther, is try to increase adoption by selecting the right use cases that will trigger the needs of patients, citizens, I mean, and also aligned with the possibilities of the wider market to provide such services. So we need to be pragmatic and advance in a step-by-step approach. I think this has been clearly depicted also in your national strategy, if I understood correctly. And this is how we are going to proceed. And I understand that this is your recommendation for any other similar competence center that will have the responsibility of somehow enforcing the exchange format in their own countries. Now, going back to Kathy, you're always a specialist in providing the right messages and try to enforce what patient needs. So my view is, since we are here trying to create the right, let's say, discussion groups, or XNets, as we call them in our project, or other ways, I think it's important to see and have your recommendations how the patient association will help us promote correctly the exchange format, or a rebranded version of it. So I guess in all our internal, but also open discussions, your words or other patient association as well. And I would like to have your recommendations of how can we use the patient voice to advance and pass the message to also the politicians and the industry, so that we have all the voices aligned. Thank you.
Thank you, Alexander. This is really an important question, because particularly in complex diseases like cancer and other similar very serious diseases that extend over a very long period of time, then you have different needs than in other therapeutic areas. For us, because cancer is such a complex disease which needs so many different specialties to collaborate together. It is very important to have a common space to collaborate. And this common space is the European health record. There has been a first step in that with the smart card. That's the survivorship care card. This is a new project. The European electronic health record format is another big project. It's, in my opinion, it's the basis of all of the other projects, because without it, we cannot talk digitally among us. And in cancer, where we have to transfer from one hospital to the other, and don't forget that in cancer, we have the European reference networks that are digital entities which are very specialized in specific cancers. How we are going to talk among us, talk, I mean digitally, in order to collaborate with the ERNs, with patients to make use of the cross-border healthcare, the European electronic health record format is the basis for it. So for us, cancer patients, this is very clear. We want to collaborate. We want to share with the project team specificities from various cancers, because not all cancers are the same. We want to share the knowledge we have from the practical side of transporting big bags of documents, medical documents and data, and we want to share it with the project team. And of course, as a big European umbrella organization, we have 470 members in the 28 EU member states, the UK, and far beyond, as far as Chile and Japan and Australia. We can share the knowledge that is in our members, because what we want, yes, we want the European electronic exchange format, but we want also at the same time to have privacy, to have interoperability, to have respect of our data. So we are ready to collaborate with the research work packages of the project to offer all the knowledge we can share with you.
Thank you very much, Kathy. So some important messages here, I think, to keep. One is try to take examples. So let's see if we can make examples of the use of the exchange format for cancer patients and try to see how those specificities could be somehow managed through this exchange format. The other thing is open collaboration and knowledge sharing. I think this is well established and formed in the project, and I think we will advance a lot on this topic. Now, Michael, you somehow represent the industry here, whatever that means. You try to frame it a little bit. And we know that usually the industry is the one that is doing always the hard work at the end of the day, trying to find solutions. And we know that all these things, they take time. We know that at the European level, we are trying to create a European digital single market. So I think, what are your thoughts on this? How can we use the exchange formats and the new regulation to try to move a little bit faster in this domain? And what should we do to try to trigger the attention of the industry in that sector? Meaning that probably if we want the exchange format to be adopted, let's say, investments and funding from the governments and the Commission won't be enough. We also need to have some new innovations from the industry side. And so I think that's an important topic. We saw how the industry reacted immediately in the COVID circumstances, which means that there is capacity to move faster. So what is your view on that?
Boy, that's a big one. I mean, let's first acknowledge that that there is movement at all, because for a very long time, the Commission, many actors have looked at digital health as the sector that has not really been affected by digital health, by the digital transformation, and it's partly because of this persistent lack of interoperability. Because there was no dominant market actor like in consumer electronics. There were, or like in videos, where industry could simply impose it. We just haven't had that in healthcare. And so finally, the Commission in 2019, with the publication of the EHR exchange format recommendation, said, okay, look, maybe we do need to do something here. And now, of course, in 22 last year with the EHDS, there is now an appetite for the Commission to accept a role and to work with the member states together to work on common specifications. I think so now at least a goal, a vision has been set. Now, moving even faster, I think we need to be realistic. It will be a long travel. I mean, let's consider for a moment here, I invoke the mobile communications world. Back in 1990 or so, when the Commission came together and said, let's develop some GSM standards for international roaming. The world was very different, and it took a very, very long time for GSM to be the accepted universal standard for mobile communications. I think South Korea, I think, took until 2010 or so before they said, okay, let's also move to GSMA. So we will see fits and starts, but a direction has been set. If we work together, and if we work with member states that are also working in collaboration, in coordination with the Commission, like the Netherlands are doing now, like other smaller member states are doing now, then I think we can travel to that destination faster. I see a question posed here. Will we have to have two different certifications? Probably for a time we will, because there are too many specialties, too many idiosyncrasies, perhaps in the Netherlands, that distinguish it from Greece, distinguish it from Bulgaria, distinguish it from Germany. So we will see an EHR exchange format setting the general direction, and national member states moving in that direction, but with the obvious intention to move towards a common European certification. So we will need to have mechanisms, we need to have collaboration, we need to have industry input. But if we if more member states can follow the Dutch example and that of other smaller member states, then I think we get to that faster. So bottom line is this: collaboration takes it, a common vision is needed, and a lot of goodwill among all actors, and then I think we can move faster together.
Thank you, Michael. So we don't have a lot of time. We have 4 questions. I think some of them, I think that Michael tried to respond to the question of Michael on the Q&A session. And I don't know, Anderson, if he also somehow replied to your first question about the alignment in the industry. I think that he made a quite substantial effort to do that, trying to speak about collaboration. Obviously, we are a project that we want to connect with other projects. So I guess, again, Anderson, you are asking here from the audience if there are other projects that we would like to get from the list. So please, people, that participants, if you think that any project that you are working on or participating at any level, please send this information to us, especially to Anderson as the project coordinator, and to Enrique Martins, so that we can incorporate this in the discussion that we have internally. I don't know if any one of you would like to mention anything on the different questions raised. There is also a question from Diane about how we are going to work with other projects. So obviously that's a topic, and I think within the project we have already thought about collaboration with other projects, the joint action on other, but I don't know if Esther or Michael, you would like to say a few things about that before we close. And Kathy as well, you're welcome to.
Well, I am just thinking we have among the 31 projects in which CPC participates now, there are projects in which we could talk about the importance of the European electronic health record, and this is the CCI for EU, the Comprehensive Cancer Infrastructures for EU. That is the project that will set how the infrastructures will be developed. And when talking about infrastructures, we are talking about, as we are talking here, about infrastructures in IT, infrastructures in training for doctors, training for patients, organization, all that is needed for making the comprehensive cancer centers to operate. So among those, of course, the electronic European health record exchange format is basic. How all these complex systems of comprehensive cancer centers will operate without it. So it is not mentioned yet. We have discussed about collaboration with the European Health Data Space, but indeed, talking about it today, it's a good opportunity to raise the flag and say, hey, in the next consortium meeting that we should invite the electronic health record, electronic health record exchange format people come here and tell us about infrastructure for comprehensive cancer centers.
Okay, so that means that we have at least of 30 projects that we can discuss together and see where
yes, we have, but I mean this one because the comprehensive infrastructure, comprehensive cancer centers infrastructure for EU is basic. We are going to design what infrastructures the comprehensive cancer centers will need to operate, and this is basic.
Okay, now thank you very much, Kathy. Michael.
Alexander, if I may, and also looking at Dimitri's question here, there is one thing about collaboration with projects and projects taking this forward. But what I really want to stress here, what is really new here, is that with the EHDS regulation, there is now the power of legislation. And with the developments in the Netherlands and other member states, this legislation now translates into actual procurement. So for a very long time, industry could just sit here and just watch or ignore what has been happening in projects. But I think now we see the power of regulation. So we're seeing a discussion change, a discourse change from adoption to actually compliance. And once these specifications translate into actual procurement, you will see you will see industry moving in that direction. Because the other thing that the EHDS legislation unlocks is investment. There will be lots of investment now that the direction is clear. Regional, national members, healthcare systems will now start investing in infrastructure, and that will, of course, benefit us all.
Thank you, Michael. I think you responded also to Dmitro Bachenko's questions on this, so thank you very much for that. Esther, there's one question I think directed to you, but probably you can type it in the response. They are requesting for a link to the Dutch legislation. So if you can provide that, I think we are then have responded to all the questions somehow.
Yeah, sure, I can.
Thank you very much, Esther. So I think that we have reached our goal in making this initial discussion. So some points, I think I have tried to summarize some of the points during the discussion. So as said, this session is recorded, so we'll try to gather all those points and try to analyze them and present them to all of you that participated, but also to those that have not participated yet. So don't hesitate to contact us at any moment. Please use the QR code if you want to see how we are working and access the webinar series on the social media. Also, we are going to create and stay tuned with the project, a community of doers that will have both the industry and the patients involved. So maybe some of the discussion and the points that Kathy raised, we will try to discuss in this community of doer. So very soon we will have news about that, and maybe it's going to be the topic of one of our next webinars, how we're going to work together in a co-creation approach, trying to learn by example and advance. Of course, as Michael said, the regulation is important. And I think in steps a little bit in the carrot and the stick approach, I think that the industry will be more interested in adopting those standards. So with this, I would like to thank you all for joining us today. And I hope to see you all in our next XpanDH webinar. Thank you very much for participating, and I hope it was an interesting session for all of you. Thank you.
Thank you.
Thank you. Bye.
Bye-bye.
Bye-bye.